Welcome here to our next session of the Mars webinar. Happy and healthy 2022 from the Mars team and from Professor Breisach to you all, to our lovely audience. My name is Lutz Wilmer and I will be your moderator tonight. And together with my good and old friend, Stefan Walzer, the CEO and founder of Mars, we want to continue the tradition in 2022, as always, with the last Thursday of the month at 2100 German time. We have our webinar series about the topics market access and reimbursement. So just before we come to the special one, new Minister of Health, let me explain about Mars. Mars is the German-speaking market access experts for your topics, pricing and reimbursement strategies, reimbursement submissions for the German GBA, also with the German DGAS, Digital Pathways, Fast Track Procedure, the Swiss BAG, or the Austrian Hauptverband. Also, we offer you all support with health economics and also with negotiation supports, including our virtual reality boot camps, which you see on the next slide, and that, of course, in all German-speaking countries, so Germany, Switzerland, and Austria, and maybe Spanish Mallorca in the summertime. Okay, but before we think about the summer, maybe you heard about our MAP podcast, our market access podcast here already. If not, check it out. It's in all popular podcast platforms for iOS, Android, Spotify, and many more. And check out the episode, the special one with our good friend Renato Della Mano from Italy about the art of war, not the art of war, the art of pricing, right? Is pricing an art or a science or both? And also the one with Bastian Biermann from the Private Health Insurances Association here in Germany, and how the private health insurances can be your entry into the market. Yeah, but coming back to the webinar tonight, as always, feel free to ask questions. After the presentation, we will have time for your questions. Use either the Zoom chat function or the question and answer function here in Zoom to raise your questions or comments. And first questions as always, we provide afterwards the video on our website. But now let's go on our website, www.marketaccess-pricingstrategy.de. You find our last webinars, also subscribe to our YouTube channel, and there you find also the last one, our Christmas special with our good friends from Advance, an interactive talk about the past and the future of AMNOG, as seen not just from the German side, but also like from the other European countries. Really, really nice Christmas webinar here. You can also check out, but also all the other webinars we had in the past. It's all on our website, www.marketaccess-pricingstrategy.de. But now let's come to our speakers tonight, to our point tonight. You wanted them, you get them. Tonight's speakers are Dr. Stefan Walzer, who's the founder and CEO of Mars. Stefan is a health economist with a long career in market access at Roche. Well, welcome to Weil am Rhein, Stefan.
Yeah, hello, everybody. Thanks for joining. Good evening, Lutz. Good evening, Professor Breisach. Happy to have you.
And then also tonight, we're really happy we got him here tonight, live from Freising, Bavaria. Professor Dr. Thomas Breisach. Professor Breisach is a professor of health and social management at the FOM University for Economy and Management in Germany's largest private university with over 55,000 students, and describes himself as the advocate of strategic pragmatism. And we're really happy to have him here tonight. Good evening, Professor Breisach.
Yeah, good evening to Baden from my side. I hope that you are fine there. And it's a pleasure to be with you for the next 30 minutes.
Perfect. And now, Stefan, tell us, who's the new kid on the block?
Thank you, Lutz, for the nice introduction. And yes, of course, I think the new kid on the block, I think we waited a bit, and we had obviously a lot of different information also in the press. But let's maybe start with what happened, I think, rather a couple of weeks before we knew the name and the new kind of Minister of Health in Germany. So what happened in autumn last year? I think you know that's nothing new, right? There were quite some up and downs between especially the first three parties here, finally, it was especially between the Social Democrats and the Christian Democrats. The Christian Democrats with the black bar and the Social Democrats in red. I mean, early in the year in 2021, there was even the Greens, which were quite up around the 20%, and the Christian Democrats, even I think a bit below. It was quite an interesting race, but at the end of the day, we had the probably the kind of last minute race, and I think even in the way that I would say whoever moved first lost, basically. I think that was probably also the kind of case here with that kind of election, meaning that whoever didn't make a bigger kind of mistake, I would say, in their kind of campaign finally won as well that election. So what was the result? Finally, the Social Democrats won with roughly 26% of the votes. The Christian Democrats had 24.1%, and then we had the Greens and the Liberals with somewhere between roughly 12 and 14%, and the AfD with 10%, the left not in the parliament. What did that mean in terms of wins and losses? We have seen quite significant wins by the Social Democrats, 5% up in comparison to the elections in 2017. We had a big kind of drop by the by the Christian Democrats of nearly 9% points. I think that was obviously a dramatic effect. I would say even the equate would probably agree to that this is a dramatic effect here. And the Greens with the highest, I think, number of votes what they ever had in an election across Germany with a plus of 6%. So then we had a lot of back and forth. Obviously, it was quite interesting to see also in terms of who first, let's say, approached which party first to also check what is really doable. I think interestingly, I think at least I would say the Greens and the Liberals got their kind of learnings from the 2017 kind of discussions on the different kind of, let's say, probably opportunities. I think nothing was really getting out, or really not a lot. I think it was really available and finally in the press. I think it was difficult to find any kind of, let's say, directions also what was especially also being discussed. So content-wise, it was really difficult to see a lot happening. I think it was only probably really what was then finally being communicated by the various parties and by the different responsible then also stakeholders across the process. So then we had in December, I think let's say since December, we have a new government, which is then being let's say populated by the Social Democrats, the Liberals and the Greens with a new chancellor. I mean, not that new. I mean, he was also already part of the government with Angela Merkel, but now he's the chancellor. And I think the core kind of question was a long time, basically, who is and will be the new Minister of Health? Why is that maybe also an interesting part, besides obviously for all of us who have now as well, let's say, checked in and are interested in the topic, obviously, because we're working in that field. I think it's especially probably quite interesting to see how these kind of, let's say, next steps or changes maybe as well in the general healthcare environment might go further. I mean, we're not chatting here about, say, the former Minister of Health, Jens Spahn, but I think at the end of the day, we could at least say he was quite active. I think some maybe even said, at least at the very early beginning, he might have been hyperactive. There were so many different kind of things happening, or at least basically as well brought into discussion. So just really a snapshot, right? I mean, he brought really a lot of different kind of legal parts into parliament, which also passed in parliament. But I think just from our perspective, let's say from a market access side, I think those, let's say 5, which we just picked out there, were, I think, at least quite important. I think one part, I think there was a change in the inpatient coding part, the DRG, where they have basically excluded the care costs. I think not so much of a, let's say, a very important major drive, let's say, from a market access perspective from our side, right? Even though that it has had some kind of implications for some medical devices. But I think interestingly, we're especially also the kind of, I mean, it doesn't look so, probably doesn't really look really prominent, right, with the D gas and the D pass, but whoever is a bit in the kind of topic or have maybe as well followed us in the last couple of months and years, I mean, knows exactly, I think that this might maybe change the environment, especially in terms of digital health. And I think the kind of pathway also how to get onto the market, even though that it's not only, let's say, the kind of really easy kind of pathway, you need as well to show the benefits, you need to have strong kind of evidence, etc., and a lot of as well IT requirements which are needed. But still, I think it's, from my perspective, really good kind of pathway into the future of digital health in Germany. Two other parts, just very briefly, strengthening the use of biosimilars. I think we had Matthias Flume in November here in our discussion. I think he might have been quite happy that this might also, let's say, go a bit further. I think you could also turn that maybe a bit around and just say it might also free up further budget for new innovations in the future. I think similar kind of discussion with generics. And I think finally, I think probably within one of the last legal parts which passed Parliament before the elections, as far as I remember, was also kind of very small inclusion there, where at least for 18Ps, and NUP can now also be submitted not only in October of a year, but also in April. Interestingly, maybe, or maybe a cool question also why this might only be the case for 18Ps and not for other products as well. But having said that, that was the past, as Lutz said already. I think what has happened, what will happen is maybe as well the kind of question. Lutz, you introduced us quite interestingly. That is why I was laughing a bit, because Kevin Kühnert, one of the prominent social democrats, I think, but also I think Olaf Scholz, the new chancellor, was introducing the new Minister of Health in that way. In German, it's basically said, ihr wolltet ihn, ihr kriegt ihn, so you wanted him, you'll get him. I think it's maybe a question also later on to Professor Breisach. I mean, what should we really, or how should we interpret that, right? Who is the you, and what should we really get once we have, I think, Karl Lauterbach now? But still, the question is in the air, right? Who is the new one? Who is Professor Dr. Karl Lauterbach? And I think before maybe starting there, it's maybe also the question, is he the special one, or is it maybe the normal one? Or as Jürgen Klopp said,
I don't want to describe myself. The only thing I can say, maybe I ask her, does anybody in this room think that I can do wonder? No? So let me work. I'm a totally normal guy. I came from Black Forest. My mother maybe sit in front of the television and watch this press conference, understand no word until now. So, but is very proud. She's very proud. So I'm a totally normal guy. I'm the normal one, maybe, if you want this.
So Jürgen Klopp is maybe the normal one, but still it's a question, right? Who is Karl Lauterbach? I mean, he's not from the Black Forest, so he is different to, I think, Jürgen Klopp. I think we know him as well from his previous, let's say, life, also, let's say, from the political life. But just very briefly, I mean, just that everybody has a bit of a background. I think Karl Lauterbach studied medicine. I think he also studied health economics and epidemiology, has a doctorate from the Harvard University, and he's also a university professor at the University of Cologne. But I think interestingly is obviously since 2005, he's a member of the Bundestag, so of the parliament, and since 2009, he's the health, or was the health spokesman of the Social Democrat in the parliament. Just to have a bit of a frame, right? Just to see where he's coming from, where obviously this is still not telling us a lot about content, right? I mean, maybe also later on, Professor Breisach, a bit of feedback. Obviously, I'm coming more from the industry side, so we know him as well. Let's say, let's call it maybe quite nicely. He was not that positive in the past, let's say, in front of drug pricing and the industry. So that's maybe as well a bit the question mark, obviously, what might we really see in the future. But what do we really know up to now? I think currently we don't know really a lot, right? I mean, what do we know we'll have on the next couple of slides, but I think important probably also keep in mind, I think that we might have a couple of various negative effects on tax income probably. I mean, the virus is clear. We had some really, let's say, challenging kind of events as one in Germany, I think last summer and autumn. And I think that is also why we would say, and that's also, I think, let's say, common sense. I would still say common sense that stakeholders expect an entry into force of a saving law. We haven't seen it yet, but I would also just say this is maybe just because COVID-19 is still on top of everybody's mind. So it's maybe also the question later on, is there maybe something already coming short term, or is that maybe just something potentially being into the kind of, let's say, air for the near future? What do we know? I think what we know up to now is already set in the coalition paper, in the agreement between the three parties, that the mandatory rebate for drugs will be increased from 9 to 16%. I think that's an important kind of, let's say, change. And I think even more important, and I think whoever is following us, I think we have discussed quite a bit how and in which ways AMNOG might potentially change. At least what we know so far is that the three parties have agreed that free pricing within the AMNOG process will only, let's say, last for the first 6 months, meaning that starting with month 7, paybacks need to be then paid. You might remember currently within the AMNOG, you have 12 months of free pricing, meaning as long as you basically have the benefit assessment and the price negotiation, as long as that for meaning for 12 months, industry had free pricing, and only after month 12, so starting with the 13th month, a new reimbursed price would need to be applied for. That will be obviously an impact. So meaning that after the benefit assessment by the GBA, the price will then be changed, obviously backwards, because just then the price negotiations will still start, right? So that will, at least what we know so far, not change, but that is probably a kind of major impact. And I mean, just keep in mind, I think there were even, let's say, discussions whether the whole kind of free price will overall be stopped, right? That a full kind of, let's say, payback might have been in the air. I mean, what we still don't know, I think, is the orphan drug, let's say, regulation within AMNOG. Nothing has been found so far in the coalition agreement. However, we just see, I would just at least say that we see a heating up of the discussions in the last couple of days and weeks from different stakeholders, from the insurance side, from IQWIC, from the GBA. Maybe the question whether this is also already preparing a bit at the kind of next steps also from the Ministry of Health side. Further expected changes, I think merging of DIGA and DPAS systems for kind of listing. I think that's maybe a kind of part what we might see, the kind of benefit assessment in there as well. So DPAS might as well, I think, now just start with their kind of, let's say, progresses. I think DIGAs, we have now just seen the first kind of price negotiations, but that's independent of, let's say, the new person, the new one in the Ministry of Health. I think potential changes in the financing of hospital investments, I think that is what has been seen also within the three kind of, let's say, at least offers, if I want to call it like that, from the three parties now in charge. So I think there might have been also something already in the pipeline, at least for discussions maybe. But I think otherwise, at least not what we have seen so far, but obviously we're all open for your thoughts in general, also for medical devices. So, Professor Breisach, this is just a kind of frame. What do you expect from maybe the new government, but probably also from Karl Lauterbach as the new Minister of Health?
Thank you for giving me the opportunity to speak to you. So I would really recommend not to underestimate the new one. I think this is something which happens quite often, and he is the most popular politician in Germany. It's just a very new survey that came out yesterday, so he's ranked #1. And in addition, there's another survey, so this is interesting or important for drug producers, that 90% of the population believe that drug manufacturers are demanding too high prices. And if you put together these 2 points, and if you know that he's always very strong in criticizing the drug prices, so this would be my advice, not to underestimate him. So I would recommend to use the pandemic for the preparation of the strategy or the politics that would be or has to be done by the manufacturers. And it's obvious that a lot of people have the impression that he is not very focused. So from my point of view, he's a type of a hybrid of a scientific and a practical policy expert. So he's coming from the both sides. You have already mentioned it before. He has a lot of experience in coalition negotiations. He has participated to the talks since 2005. So he has a lot of experience, and I think his favorite or personal goal is an evidence-based approach in the healthcare system. So, and this will become a challenge. So everything that you can base on an evidence base gives you an advantage. So he will double check and challenge. And the other 2 fields he is, what is the nickname? Mr. Corona or Mr. Bürgerversicherung. So this will not run. So now he has to rely on the criticizing the drug prices. So this is the other topic where he is well known. And you already said he's not known as a big friend of the drug producers. So he's always double checking or challenging the price policy. And you have already mentioned the first discussion points of the coalition paper. I think it was 1 or 2 slides before. So we have mentioned 9 to 16%. And I would really say use the time frame to prepare yourself, and perhaps also the opportunity that he's not a good communicator with a broader audience. So he is feeling quite comfortable in talk shows or in a scientific audience, but with a broader audience, that's not his special field of activity. And I think this could be a chance to challenge his communication. Perhaps you have seen this discussion in the German parliament yesterday. I don't know whether you have seen it. So he made the wrong quote at the end. So he had 3 minutes of talk, and at the end, he ended up with the wrong quote. And I think this could be a sign that it's a total different situation for him being a part of the legislative or the executive field. And this could be a chance. So if you are well prepared and that you challenge his communication, that you take him seriously, so that you don't underestimate him, and that would be my recommendation in this field.
Yeah, that's a good one. I mean, if I just take that up, because and I fully agree with I think what you said. I think especially maybe in terms of communication, etc. But I mean, what we also know, for example, from the political side, if there's a change in, let's say, the kind of head of a ministry, I mean, sometimes this might also, let's say, lead to, let's say, strange kind of situation. I mean, we have just seen, I think, 2 core persons have also left the Ministry of Health, even that I would say it has probably nothing to do with the new minister. But I mean, how do you see that kind of, let's say, flow within the Ministry of Health? Is that maybe something where we could also expect, let's say, slow down because people were still, let's say, in the mood of Jens Spahn? Or would you rather say, you know, I mean, if we see the kind of, let's say, attitude and also the, let's say, the kind of direction, the thinkings from Karl Lauterbach, you mentioned evidence-based medicine, drug pricing, maybe that maybe the minister or the ministry is generally maybe getting even, maybe call it even more effective. I don't want to say efficient, I mean, but even more effective, meaning that it might even go a bit easier because maybe the members of the ministry might even follow Professor Lauterbach even easier. What is your opinion on that?
Yes, I think he could have an easier start than Spahn had. So because he has a reputation as a scientist, he has a strong reputation as a health politician. So there are a lot of people who are not far away from his kind of thinking, and therefore I think he could be more respected as a specialist in this field. And he's quite known. He knows all the actors in this field for almost 20 years, and this could be a big advantage for him. And also yesterday he gave a signal that he would be open for cooperation with everybody who has a pragmatic approach. Yesterday he had a discussion about the vaccination, but I think he has the standing that he is accepted as a specialist in this field, and this is a different position in the field of discussion with the other parties. So we know his thinking. We know his thinking towards the pharmaceutical industry, for example. We know that he is evidence-based driven. So, and a lot of people working in this field, they like this approach. Yeah. So I think he could have a better start, also based on the situation that he is very popular within the people in Germany, and I think this could be also an advantage. It really depends how he will handle the next weeks or months. So if you follow the comments or the quotes in the media, der Staat der Ampel ist verwundet, or what was Lauterbach führt ein Doppelleben, verspielt seinen guten Ruf. I don't think so. So I think he has a stronger reputation within the population right now than he had some months before. And yeah, so I wouldn't expect him to be too weak. So because he will rely on the field he feels comfortable in, and I think so. This is the price policy. So there is a good field, and if you read the publications coming from the German health insurance, for example, AMNOG reports from DRK. So this is more or less his game. So they ask for new regulation. They mentioned that often drugs have a too poor quality, not sufficient data. So they just opened a new field because I think it's quite easy to get a broader audience for support if you mention the price often drugs have at the beginning. So yeah, I expect that this could be comfortable for him. So in this approach, approving a mandatory additional benefit in orphan drugs from the beginning. Yeah, so I think this is quite a change in the original setup of the AMNOG. And as we know, Lauterbach, this is in his mind since several years that he wants to evolutionate the law.
Yeah, no, I fully agree. I fully agree with that. I think maybe another interesting part where we had also some discussions already with different people, also with different stakeholders. I mean, you said it already. I mean, he is an expert. I mean, he's a scientist in a way, right? I mean, I think that's quite clear. I mean, sometimes scientists have an issue in, let's say, deciding, at least from a political side, right? We hear that a lot of times, right? I'm not the decision maker, I'm just the expert. Could that maybe as well be a kind of, let's say, hinder in order to really bring the healthcare system in Germany really to the next level, meaning really from a care perspective? I mean, we still have a lot to do from a digital health perspective, for example. What do you think about that? Is that maybe something which might be a kind of issue, or would you rather rate that as, you know, he is an expert, but I think he might just go tries to do his agenda and he will decide on that?
So he will not be able to run his agenda by his own. So, and I think this could be a huge difference. Before he spoke as a member of a parliament, as a scientist, as you said before, but not as an executive person. And now he has to head a whole ministry, which is a big one, and which has a quite negative connotation. So it's not one of the popular ministries that we have. So you can't win with this ministry. So you will always be under pressure, and there's a lot of lobbyism around. So you will get under pressure, you will get criticized, and it's a total new situation for him, because before, yeah, he made statements, he was quite often in discussion in talk shows or in the parliament, but it's totally different whether you can debate or discuss, whether from a political or scientific point of view, a topic, a health topic, or whether you are in charge of the execution of the laws and delegating or regulating the whole system. I think this could really be a challenge, because seen from my point of view, this is a new field in his political life. So he can't act as a scientist. This will double challenge him. So I really expect that this will challenge him, and I don't know how we'll get out of this or how he will handle it. He will have to prove it. Now he has the first proof. He has a very living discussion on the vaccination topic. But I clearly believe that there will be a lot of people around using this time for preparing other topics. For example, our medical devices topics, the hospital topic, the drug situation, the AMNOG situation, the orphan drugs and all this. So I really expect that if they would act in a strategic way, they would use this situation to prepare other topics which are very important for the whole system. And I expect so that there are some of his team members doing it. I hope so at the end.
That's true. Yeah, taking the time of the COVID situation, preparing already some kind of next steps. I would agree. I think that's
yeah. And if he will not be successful in the COVID situation, he will have to prove his capability in other fields, and then he has his special fields of activity, and one of these is criticizing the drug prices, and there you will get a big or great support from the population. I know it from my students. If I'm discussing this storyline, it's more or less common sense to criticize the pharmaceutical industry for its prices. Yeah, whether it makes sense or not, but you have to accept it, and or at least you have to tolerate it and to think how to handle it or how to discuss it. And so he could use this to get out of the Corona discussion, where it's not clear whether he and his ministry will be successful or not. So what means successful in this case? But anyway, this discussion will last. And so there could be an exit strategy to focus on other topics. And then he has one where he feels very comfortable in.
Yeah, that's a good point. As I see it, Karl Lauterbach is really popular, and he made really this popularism through being the only politician that had, like, from my point of view, like a clear statement during the whole Corona pandemic situation, right? In all the talk shows, he was like the only politician who had like an opinion, right? And said, well, and proved that with like articles or like, you know, we are listening to Professor Drosten, and he was also like the Karl Lauterbach was also quoting these articles and journals and studies and stuff. So is that where he gained the trust of all the ones who wanted him? So of the population of the Germans?
That's a good question. At least I got he got position by his scientific expertise. And so he was always presented as a scientist, also being in politics or a politician with a very strong scientific background. So I'm not sure whether this was made by him or whether this was only made by media. But anyway, at least the people had the impression that there's someone talking about something. And he knows what he is talking about compared to a banker like Spahn. Yeah? And whether this is correct or not, but this is an impression that you had if you were talking to people or you were following discussions. And but at the end, he will have to deliver. And perhaps he learns out of this, because if he says that he is so evidence-based, perhaps he could learn out of the actionismus of the former government and probably act in a different way. But I'm not sure whether he or his team will be able to do so, because to act in a strategic way is much more difficult as a politician than asking for it as a prof. Yeah. And so I'm not sure whether he will be able to do so, but it would make sense. But he, anyway, he will have to deliver. And he will get critics, so people will not be happy about the decisions which are linked to him, whether they came from him or not. So yeah, at the beginning, perhaps it's an advantage, but I'm not sure whether it will be like that in some weeks. So, because there is an increasing frustration about the whole situation with COVID. So about the promises that you have made with the vaccination, for example, and yeah, you weakened your statements every month. And this is also something which could become a problem for him, and the expertise which is linked to him. So it really depends how people will get out of this current situation. But this is only the popularity of him. I would never say that he doesn't have the expertise in this field. So I think he has a lot of expertise and a lot of know-how. And that's why I said from the beginning, don't underestimate him. Even if he is getting under pressure right now, it would be the wrong way if you underestimate him.
So, and looking at the person, at Karl Lauterbach himself, I know that there's a funny story that tells him a little bit something about it, that former Ministry of the Chancellor's office, Helge Braun, said, well, he won't never go again to Karl Lauterbach at home for dinner, because Karl Lauterbach lives really healthy food, right? Doesn't use too much salt. There's the story from the press, from a journalist who was going for dinner with Karl Lauterbach, and then Karl Lauterbach ordered salmon with vegetables in his favorite Italian restaurant, but the salmon just like plain cooked, just with a little tiny salt on it. So does this tell us something more about Karl Lauterbach himself, the person Karl Lauterbach? What kind of type he is? Is he a really strict guy or really forward guy, or what's your opinion on that?
Yeah, but I think this is something you would have to ask journalists who are really acting with him. I can only see him from the outside and talk about his political statements. So I don't know him by person, so therefore I can't make any statement on this. But I could rely on one of the statements in the chat. So whether they could use the populism to criticize the farmer, yeah, they could so, because I think there will be a broad acceptance. There would be a broad acceptance if you strengthen the law in this field, if you strengthen the opportunities of the state or the health insurance funds in the negotiations. So I think this would be quite popular, and yeah, you can do so, you could do so, and this was only a statement on, I don't know who has asked the question, but I just saw it in this moment.
Yeah, I would agree. Just very briefly, I mean, just backing this opinion up there, right? I mean, it is obviously difficult, let's say, to explain to a lay person that maybe 200,000 euros for a drug is the right price, right? Because it may be saving lives and it's maybe just for 10 patients, but it's still difficult for lay persons, let's say, to grasp, right? And I think that's maybe the easy part also in this way then to communicate to the wider population. I would agree. I think this is maybe also a bit of the dangerous part, because obviously always as well, pharma is an easy target, and it was always, right?
Yeah, and it's quite interesting if you use this pressure versus the pharmaceutical industry, there are no negative connotations. But if in some media, for example, 2 years ago, talking about Zeugnismal, there were some articles about the price of the product for little John or little Ben, the two guys. The health insurance funds have been very sensitive because for the first time they have been really under pressure by media asking, so there should be help for this guy, for this little boy. And immediately the reaction of the health insurance funds has been, don't set pressure on us by media. And I think this is something totally different. So because the pharmaceutical industry or the medical devices industry or diagnostic industry is used that there is this type of criticism. And that's why I said, yeah, you can prepare to it. You will not be surprised about some activities coming up. So this is totally different, whom I'm criticizing. And but for him, it could be helpful to position himself. So I don't expect that he will really criticize the health insurance fund at the moment. So for him, the easier target, or for his team, the easier target would be or could be the drug manufacturers. And I don't know whether this will be used, but it's a total different situation because we were talking about his popularity or the acceptance of politics by a broader audience or by political groups. And I think this is different, but it was just an answer to the question down here.
Perfect. Then we have another question from our lovely audience. Maybe you know that what is Karl Lauterbach's view on telematic and the German digital infrastructure and the Gematik, our really lovely German digital healthcare institution, Gematik.
Never-ending story.
Yeah,
you could
it's even worse than the airport, right, in Berlin.
I wouldn't bet on this. No, but it's a never-ending story, and there has been a discussion on data safety, and 2 years ago, so he made statements on data safety. Then he has stopped the current process at the moment. But I wouldn't say this is not the first line of challenge at the moment. Yeah, so because we are used to wait for it. So we have some other topics seen from my point, which are higher ranked. I'm not seen from a strategic point of view because it would be very helpful if we move forward in the digitalization in this field and find solution on this. But I'm not sure whether he would open another field at the moment. So I think he will use his energy to organize the whole COVID situation, and I wouldn't expect here a very provocative approach or something like this. So it wouldn't make sense because, as you just mentioned before, we are waiting for this now for 10 years or even longer. So why should you be in a hurry now within the next 2 or 3 months? So if you can, or if you have to work on a better solution. I really think that we have other topics which are more relevant for him at the moment.
Yeah, and I would agree. I would even maybe add, because we have just discussed about the general population. I mean, with what could you easier win, right? I think it's easier to attack the pharma industry, just to take it up again what we had a couple of minutes ago, instead of just saying, look, I have just finally, let's say, put down the digital health infrastructure. I mean, that, I would love it, right? And you might love it, but I think the general population, also when I speak with friends and also with relatives, for them, it's not the major issue. I think so. Also strategically, yes, it is probably somewhere on the radar, but I would fully agree with what you just said. I think it's not at the top of the priorities.
No. And thinking about the point that also the whole digitalization topic is one of the liberals' favorite topic, right? They want to have it, and it's all over in the coalition paper. I mean, you find everywhere the digital breadcrumbs that you want to improve. So it's like, I think he would just like take it a little bit as a game player and lean a little bit back, look what the others are doing in the digital, and then pushing his expert in the ministry there at the right time.
Yeah, I also would say that's not ranked number one. So we have the focus on the healthcare system. We have the care services, which are under discussion. We have the stability, to ensure the stability of the system. So the other topic is just one of the topics. So if you follow the broader discussions, I would say the other three topics I've mentioned so far are much more in the focus than the telematic or gematik, at least gematik. And as you also said, digitalization in this field is always driven by the FDP as a topic, but I think the others are big ones. So we have a severe discussion about the healthcare professionals, the whole system, the hospitals, what about the infrastructure, reimbursement. I think there's a lot of topics, and he will not fall in activism. This wouldn't fit. So you have a big challenge at the moment. You will have to show whether there can be a solution. Then you have other big topics, and this is a support function. I would say, I would also be very happy if it would work. As a personally, I would be very happy if it would work, but it's a support function. But you have, I would say, you have problems with the strategy, you have problems with the structure, and following Chandler, structure follows strategy, and then you have to operationalize it. So, it's only one of the fields. I think he has bigger problems at the moment, or bigger challenges, to say it this way. So it's more forward-driven.
Yeah, that's true. Yeah, that was just a report from the GKVSV, from the head association of the digital health insurances, about the DGAS, right? And they sent it to Berlin. There was just a press release, and we were joking. I mean, with Jens Spahn would be still as the Minister of Health, right? The next day you would read that numbers in the press, right? Already, and we haven't heard anything yet. So I think they're going to prove the report quite a while now. Okay, that's great introduction. Thank you very much, Thomas Breisach here. Have you here in our Mars webinar. Thank you, Stefan, also for the lovely introduction here. And to our audience, as always, if you want to rewatch that video, it's on our webpage, www.market-access-pricing-strategy.de. Check out there our webinars. And having said that, before we finish just our next webinars on February 24th, we have our good friend from Italy, Renato Della Mano, here on the webinar about the pricing strategy. We have a lovely hour with him, art or science. And then in March, end of March, last day of March, 2 years COVID, we have looking back the situation, the clinical and the financial implications with the pragmatic person, Harald Herholz from the KV Hessen, and also Dr. Stefano Capri from the academic side from the University of Catania. And then in April, end of April, 100 days left to the NUP submission, to the special extra hospital funding, the neue Untersuchungsmethoden. So time to talk with our good friend, Dr. Marcus Thalheimer about the NUP and how you get that the best in place. So that was our webinar tonight. Thank you again. That was Professor Dr. Thomas Breisach from Bavaria, from the FOM University here. Thank you very much for joining us. And also Dr. Stefan Walzer, CEO and founder of Mars. My name is Lutz Vollmer, and we all wish you a good night and good luck. Stay healthy.
Good night, and thank you for inviting me. Goodbye.